Okay.
Yeah.
Well, good afternoon, good morning, good day, wherever you are. I wish I was in Mexico actually, but I'm stuck in an office in Manchester in England, and Louise is in Lancaster. We're both from Imagination Lancaster, and we're part of a research cluster that looks at population and policy. And this presentation is based on some work we've done in the last year. So Louise only started working with me last January, although I've known her for quite a while, and we actually started working together in February, and then we were in lockdown in March. So I think we've hardly spent any time together physically in that time. But because we were looking at policy, we suddenly thought this was an opportunity to look at the role of design in pandemics. So today we're going to talk about our research and the research we've done so far. Louise, do you want to move along? So we have been undertaking some research about what's been happening in the world in terms of the design's response to the pandemic. And we've developed a database, which Louise is going to talk to you about. And we've been looking at examples of design activity during the last year. And we've classed those responses into 4 phases: reaction, adaptation, recovery, and resilience. And Louise is going to actually give you some examples of that later on in the talk. And so at the end, we came up with some principles for, some principles for resilience, but we started with the question, what role can design play in the recovery from COVID-19 in building resilience for future pandemics and global emergencies? So specifically, we've been looking at how design has been deployed around the world to harness creativity and innovation. How we have approached the challenges and opportunities that have emerged, and how designers have worked across disciplines and across borders to develop solutions that are highly complex problems in the pandemic. I mean, we know that design is a discipline that works across boundaries. We know that design can tackle wicked problems. But we also know that there are some wicked problems hitting us, not just pandemics, but climate change, the whole issue of urban health, inequalities, health and well-being. So we believe that design can actually address these problems, but we wanted to develop a sort of documentary of what's happened in the last year. And we wanted to use this as an opportunity to rethink and redesign some of our practices and the systems by which we develop resilient futures. And what I'm going to do now is hand over to Louise to take you through the story, because she's been the active researcher doing the day-to-day work. So I thought it was best that Louise actually explained what she's been doing. Louise.
Okay, thanks, Rachel. So yeah, last year I can see a couple of my Beyond Imagination colleagues here. Hi, and they know that last year we started the project in January, and by March we were all working at home. And like many other researchers around the world, when the pandemic hit, we had to rethink much of the research we had planned. We had some work plans with the Policy Lab in the UK government, but obviously they were a little bit busy. So we immediately started looking at and gathering examples of where design was being used and put it into a database. Now, Excel spreadsheets aren't really made for presentations, so you can't really see it here. But so far in the database, we have over 300 examples, and they come from, we put them into kind of the rough design disciplines. So we've got product design, urban design and architecture, service design, technology design, graphic and communication design, data visualization and design, and the production of medical equipment and PPE. And as Rachel said, we categorized it into these four phases. Now, this time last year, we thought we might be out of adaptation and into recovery, but in the UK in particular, and I know America is still struggling, we seem to be stuck in this adaptation phase. So what I'm going to do, I'm going to talk through the phases, and then I'm going to go through each of the design disciplines and give just a few examples from these phases. As I said, it's just a few examples today. So as we went into the reaction phase, countries imposed lockdowns or strict track and trace systems due to rising cases, and new laws are rapidly passed and the economy essentially shuts down. Although we saw really different reactions at different speeds and at different scales around the world, as we continue to do. Adaptation, so systems here begin to adapt and society becomes used to what we now know as a new normal, moving between different modes of containing the virus, so full versus localised lockdowns, and adapting to measures such as social distancing. We find new ways of connecting socially and working remotely and carrying out conferences. Oh, sorry. And then recovery, emerging from lockdown where social distancing is still required, but many industries return to work and schools reopen. So then we have localised lockdowns enforced due to small breakouts, and vaccination and treatment programmes are rolled out and the economy shows signs of recovery. So we don't have as many examples from the recovery phase yet, and we're looking to the future as well. We're still gathering these examples and we aren't there yet. But what we're seeing at the moment is the design of complex services such as the vaccination programmes, and these are fundamental to our recovery and emergence from this pandemic. And we also see other systems that need to be redesigned as we move forward to ensure we're adaptable and resilient in the future. And as lots of people have written about over the last year, we've seen these huge inequalities at kind of societal level. So I haven't got a full picture here, but we've started to map. So along the bottom, we've got stages, and then we're looking at the maturity of the design as well. And we're aiming to get something online and kind of interactive in the near future. Okay, so I'll go through selection of the disciplines, and within those are different design solutions we've identified. As I said, we don't have so many examples of recovery and resilience, as in the UK we seem to be stuck in this adaptation stage. So with technology design and use, we saw last year a real rush to design and implement technologies to track the virus and limit its spread, and this was seen worldwide. Many of the designs for mobile applications and wearables to track citizens and the use of AI and IoT didn't fully take into account issues such as privacy, data protection, or ethics by design, which is an area that's received significant attention in various areas of design research in recent years. So in the reaction phase, the use of mobile applications to trace contacts and alert those who might be at risk of contracting the virus is being seen as a key tool in the fight against the pandemic and a key enabler to governments in reopening their economies. We tracked a range of applications from the initial react stage through to the adaptation stage to understand their design and implementation. And at the time of writing a journal paper where we pulled all this together late last year, there were over 40 public and private systems that were being developed around the world. So this is an example of the Trace Together app. And we found significant variations in the speed at which they were designed and deployed. I know in the UK, our NHS app, which I'll come on to, didn't really get deployed until September last year. But the earliest countries to be exposed to the virus, most of them implemented a range of solutions, from private and government apps in South Korea, the use of QR codes in China, which are actually really embedded into Chinese life anyway, as we see here, and Trace Together in Singapore. And Hong Kong deployed their Stay Home Safe app really quickly as well. But the use of mobile apps to combat the spread of virus, such as COVID-19, not only relies on a high percentage of the population downloading the app, this requires a real level of trust in the population. It's also really important to think about access to smartphones and the internet. So for example, in the UK, we have an elderly population and also rural populations who might not be able to access the technology or the connection. We also found that the current urgency to develop these tools has led to too much reliance on their implementation alone. And at the early stages, we saw the lack of consideration of not only usability and access to mobile technologies, but the lack of designing ethics and privacy into the applications. So this is an image of COVID test samples being delivered in Ghana by drones. So the use of drones during the pandemic was interesting and was largely focused on the delivery of supplies to those self-isolating into hospitals, but also, perhaps more worryingly, as a mode of surveillance to ensure social distancing and isolation measures were adhered to. So in China, drones were deployed to aid in disease detection and crowd management, and they used thermal sensors, high-def zoom lenses, loudspeakers and chemical spray jets to disinfect large areas. And through redesigning the application of the drones, it's hoped that less human contact will be had and the virus won't spread as quickly. So here we see a lot of existing technology that's been repurposed with new software. But in the US, their airspace regulations had to be devised to enable operators to carry out their new roles. So it's not necessarily the design of the drone itself we need to think about in light of their use during pandemics, but the infrastructure and practices in which they're embedded, and the impact on the populations for which they are operating in particular issues of surveillance and privacy. In similar drones were banned in France as they were deemed to constitute serious privacy infringements. We saw robots that have been deployed in settings such as hospitals and public parks. All of the examples included in the database are existing systems that have been repurposed for carrying out new tasks. This enabled the rapid deployment and ease of use by the operators. So in hospitals, like we see here, robots have been deployed to ensure cleaning could be carried out without the need for people to be present. And this enabled the disinfection of patient rooms and operating theatres. We also found examples of robots being designed to provide contact-free support in a range of healthcare roles, from carrying out basic monitoring and testing in hospitals to providing care for vulnerable patients and those who had to self-isolate. And as the issues we identified with contact tracing apps and drone use, the deployment of robots also needs to be considered in terms of ethics, which need to be designed into their use. And of course, issues still remain around the need to provide face-to-face care for vulnerable patients, which should be considered as part of a human-centered approach to the holistic implementation of technologies within these healthcare settings. So moving on to adaptation. In what looks like a scene out of a sci-fi film, in Singapore and China, dog robots that have been designed and produced by Boston Dynamics, and again, a technology that was redeployed into a different use, were used to ensure social distancing in parks. And the robots feature cameras and speakers, so operators would be able to sit in a control room and view the park and communicate with visitors. Here we have the UK's contact tracing app, which was delayed, controversial, and only came into use in around September. And this is why it's in the adaptation phase, and it took a long time in different systems before it was decided to use a Bluetooth system. So Apple and Google came together after months were spent trying to decide which was the best system. And this is also an example of how we saw large corporations who would never normally think about working together, just getting on with it to provide a fix. And in the UK and around the world now, we've got conversations occurring about vaccination passports. And part of their operability could be on mobile phones, which of course potentially excludes those without mobile phones, and has raised really important issues around those who have been able to get vaccinated for some reason. And then we saw wearables. So this is in Hong Kong. No, sorry, this is South Korea. So we found examples using, again, existing technologies such as Fitbit and Apple Watch. And these were used as an early warning system to monitor signs such as heartbeat before the symptoms of COVID occur. South Korea utilised this bracelet, the Save Korea bracelet, to enforce quarantine rules after people were caught leaving the house without their smartphones to avoid detection. And bracelets and bands have been designed and deployed across the world, including Hong Kong, Liechtenstein, and Belgium. So while wearable devices offer a passive experience, can be produced relatively inexpensively, they once again pose potential issues of ethics and also data creep, which might also happen with the mobile apps, where more data than originally intended can be collected and their use can be enforced post-pandemic. So just got one example from recovery and resilience here. So I talked about drones, and while drones present opportunities for non-contact delivery, surveillance and large-scale disinfecting, it's really important to remember that they often operate in environments that haven't been designed for them. So if drones become more commonplace in our environment, the design of the built environment will need to be reconsidered. So longer term use will require adaptations such as landing pads, adequate charging facilities and landscaping to mitigate noise emissions. And our colleague in Imagination, Paul Curtin, is actually doing a lot of really fascinating work around drones in this area. So moving on to information and graphic design. Throughout the pandemic, clear communication has been vital at all stages, but particularly so in the early stages when governments rushed to roll out social distancing guidance and the processes entailed in track and trace systems. So there was a huge amount of information that had to be disseminated quickly. So in the reaction phase, sorry, this always really hurts my eyes. The new situation had the potential to cause widespread panic, and we did see that with kind of panic buying as the stay-at-home orders came into force, or also in misunderstanding the rules. And during times of stress, it's really important that clear communication by governments is designed into these processes, and how design can deliver information and messages accurately with as little room for misinterpretation as possible. So the information communicated by governments evolved rapidly and was disseminated through either online or analogue channels. In the UK, the government were criticised for a lack of coherence in their messaging and imagery, demonstrating how designing campaigns rapidly and under pressure can directly impact the public's perception and understanding of key communications. And here's an example of how that was embedded. So this accompanied some quite complex rules in the UK that shifted throughout the pandemic. So this is an example of the New Zealand campaign that was considered to be a good example of how to communicate, in that the whole of the campaign had simple message, it had clear use of colour, and it maintained some kind of similarity throughout. And in the UK, the use of stay home, protect the NHS, save lives in the first stage follows the rule of three often adopted in campaigns. And that image, as we saw, was coloured with red chevrons to denote the severity of a situation and communicate clearly what was expected. But during the easing of the first lockdown in May last year, the messaging changed to stay alert, control the virus and save lives, and the red changed to green. And this was criticised for being less clear due to the association of green with go. The wording was also ambiguous, with staying alert being particularly problematic. So moving on to adaptation. And I think this image is something that we've all become really familiar with. And design continues to play a vital role in communicating messages. So this is the COVID-19 virus itself, and the image has become widely used and shared globally after it was designed by the CDC in America. And they felt the virus should be given an identity so that it would be easier to communicate the risk and make something that seems so abstract into a tangible entity. And designers there wanted to create a realistic virus that people can envision when walking into public spaces or coming into close contact with strangers. So this image, as we know, has been adapted countless times during the pandemic, and now it's recognised as a shorthand for COVID-19. So data visualisation. Throughout the last year, visualisations have become a vital method of communication to not only communicate the spread of the disease, but also death rates. And whilst charts, graphs and infographics have become essential in providing vital information, we found issues relating to literacy, of people being able to understand the visualisations, and also the bias that resides in the choices of data made, and the accuracy of data, and the potential of over aestheticizing visualizations. So here we see an example from the Information is Beautiful website, which has become a benchmark in creating data visualization. And these are some examples of a wide range of COVID-related infographics that are interactive and present a variety of data around the world. And perhaps the most trusted source of data and visualizations during the pandemic has been the Johns Hopkins Data Repository. And as they're experts in global public health and infectious diseases, they've been a source of data and information that is widely trusted. And of course, we all know the issues with kind of the fake news and conspiracy theories that have been happening over the last year or so, and the importance of getting it right. In the UK, we had a data dashboard that was developed by the UK government. So on here, it's searchable. You can download raw data to use in different ways. And obviously, the danger in presenting this kind of data is complex versus the kind of aestheticized visualizations that we see on Information is Beautiful, and it's getting that balance, which can be tricky. So we've become used to seeing this kind of chart, particularly in the UK and at the Downing Street government briefings that have been held regularly over the last year. And whilst our data information about the pandemic's changed, the approach has remained one of using PowerPoint slides and graphs to convey often really complex data. This slide drew particular criticism when it was shown in early November 2020. Cases at this point were rising again in England, and we were facing a second lockdown. And we can see the axes on the left both have different metrics. There's no labelling. There's issues with the months at the bottom, where we see surge capacity on the left and the purple lines and the blue lines. We don't have the same key on the right-hand side. The use of specialist terms and acronyms also demonstrates the danger of throwing too much at a general audience and risking alienation and fear. And there was just one key message at this particular briefing, which was essentially, without lockdown, we're going to run out of hospital beds and people we could otherwise save will die. But this is a really difficult area to navigate, as it's vital that this data is conveyed, and scientific advisors have to tread an increasingly strained tightrope between science and politics. So moving on to PPE. From the beginning of the pandemic, governments around the world struggled to cope with the demand for equipment for frontline healthcare workers and subsequently the general public. And health professionals have actually called for greater input from designers in both the design of medical equipment and the physical environments in which they spent so much time. So during March and April last year, we found many examples of masks being made at home, such as my mum, who spent, I think, the first 6 months of last year making them for anybody who wanted one. So individuals and professionals with making skills who were furloughed, such as there were some examples of television costumiers and big factories turning their production to masks. And this highlighted the fact that during the early stages of the pandemic, when people were socially and physically isolated, there was a real desire to be involved in making things while people were isolated, and also demonstrates the materiality in processes that can have a positive impact on mental health. And we also saw the use of platforms such as Facebook, which enabled both amateur and professional makers to join together from a distance to help counter the issues with the lack of PPE. And we have that tension between platforms such as Facebook and social media being used at once for good and people sharing this kind of thing, and the other for sharing things like conspiracy theories. And we didn't only see issues with the production of masks and PPE, but also in the supply chains. This was the English government's PPE supply plan from 2020, which was withdrawn in September last year. And we saw significant shortages of equipment to frontline services and then to the public. And as we moved into the latter stages, issues such as inclusivity and accessibility were also being recognised. And the issues of masks being problematic for people with hearing issues who rely on seeing mouths to lip read, and different mask designs began to emerge after that. So here we have a Burberry mask. So factories were changing their focus from making high fashion to making masks, which is also, they've become a fashion accessory in themselves. And Vogue have had, and high fashion magazines have had features on them since. And a key issue around PPE has been that they're essentially designed for men. So women have to adapt their equipment, which can often make it uncomfortable when wearing them for long periods and often become less effective. And the pandemic lifted the mechanical ventilator from obscurity. So we came across a wide range of machines that were designed and produced by individuals using their own 3D printers at home. And these girls in Afghanistan who were making ventilators from car parts. And then we saw large global companies such as Dyson and the Formula One motor racing team, Mercedes Petronas. And the UK launched their government ventilator challenge in March 2020 and spent £454 million to incentivise private companies to innovate design and escalate production of ventilators. But then these contracts were cancelled. And Dyson actually spent £21 million rapidly developing, prototyping and producing their machine in 30 days. And I haven't got a picture of that because it wasn't made, because they had real design problems with it. So this is the Penlon primer, which was created in response to the government's call. And this is a proprietary design, which lies in opposition to the open designs we gathered for the database, such as this, which was the OVSI ventilator system, a product of the Open Ventilator System Initiative. So this was a generative concept design signalled by OVSI's commitment to the Open COVID Pledge. And this is a decentralised open approach that aims to create inclusive innovation ecosystems to enable local manufacturing and maintenance of these ventilator systems. So adaptation here. We also saw things like these provocations from Ai Weiwei and his mask series that comment on various aspects of the pandemic globally. We also saw some really interesting homegrown masks, which play about with the concept of materiality and also feed into sustainability. Because as we move out of the adaptation stage, it's clear that masks will be required in the future, and the approach taken during the COVID-19 pandemic won't be adequate. Because advice at the beginning was really complex, and then there were rushes to purchase masks. And in the UK, mask wearing was only enforced on public transport and in shops later last year. It still isn't mandatory to wear masks in public. And so last year, I started photographing masks as I walked about, and I'm sure you all see they're increasingly discarded in public places, really to high streets and even remote areas. So these pictures I took in a really remote countryside in Scotland last year when we had a brief period of being able to go outside. And these are real issues when we come to resilience and sustainability, because this kind of thing can't continue. And then finally, the impact on place. So pandemics have had a huge impact on the urban realm and our placemaking throughout history. And during this pandemic, we've seen real issues with lack of access to green space and huge issues with housing quality and impact on health. And so our places at the start of the pandemic, we saw a lot of use of tape for social distancing that kind of infiltrated urban design. And that was more ad hoc. And this is another project by one of my colleagues, Des Fagan, in Lancaster School of Architecture. And this was generative social distancing carried out in Lancaster. So an algorithm was used to calculate the social distancing requirements of businesses, and then stickers and markings were generated. And this was in collaboration with Lancaster City Council and Wash Design. So this also fits into recovery and resilience. This was done really quickly and rolled out by last June. They don't have to be permanent, but if we experience future pandemics, then this kind of design that is adaptable and can be done at short notice is going to be really important. An adaptation. This is just an example of Lancaster City Centre, where the council were encouraging more active travel. And this was in part a response to get public transport and out of cars and outdoors. and actually a policy the council were planning to implement in the future but have brought forward. So we've also seen examples of policy that's been rapidly prototyped during this period. And then as we move through last spring and summer, we saw more visually attractive social distancing measures cropping up, like this plaza in Italy. And then thinking of the future in our public places, this is a quick shot of Lancaster when it was deserted last year. We also need to think about designing things like high streets and city centres. As we move out of the adaptation phase, we need to redesign business models to cope with the huge changes in our habits we've seen, and also the impact on future home working and shopping. And then in the future, this is a design for a social distancing park by Studio Press. We need to explore how access to green spaces can be made better, and how we might have more adaptable spaces and places in case we need to introduce social distancing measures again, so that we can have a healthy and attractive environment in which to live and work. So those are the examples, and these are principles that we're still working on. So how do we move towards resilience? So from the examples, it's important that obviously we have clear, effective, clear and consistent communication, that we design of, with and for community. There is equitable access to and ethical design of technologies. We design collaboratively. We think about design agility and speed, and also designing sustainably. So to take each one of these in turn. So effective, clear and consistent communication. So governments and organisations should prioritise design and communicating their messages. And designers, governments and NGOs should engage more with what data means, how we make sense of it, and how this is balanced with the aesthetic elements of visualising complex, global epidemiological data. Designers have a role in developing digital and analogue products and services to support individuals and communities to build resilience, so economic, health and social, into their lives. It's vital in equitable access to an ethical design of technologies that both analogue as well as digital systems are designed for those without digital access, and also that privacy and ethical principles are embedded by design at the outset. And designing collaboratively. So this is about the mobilisation of design and implementation through commons, which we saw with the ventilators, and this is going to be important in ensuring resilience, and challenging existing structures is vital. Design agility and speed, so utilising well-tested design methods such as rapid prototyping or design sprints will enable multidisciplinary teams to come together and work through complex issues. And then designing sustainably, we need to think about design of PPE that demonstrates adequate environmental sustainability through design and disposal processes, and also design of sustainable supply chains that ensure access to essential goods. And then we've talked about this, I'm sure, in universities around the world, how we design new systems and societies. So our next steps, we're continuing updating the database as we emerge into recovery mode, hopefully. We're looking at ways to try to make the database interactive online for others to contribute, because we realise that we've missed a huge amount. And our view, being from the UK, is kind of focused on those. Developing more principles for design, publishing, so our website at ImaginationLancaster, and we've published a journal paper in the Strategic Design Research Journal, and we're just waiting to hear back about a book proposal from a British publisher, so fingers crossed we'll be putting together a book. Okay, so I shall hand over to Rachel. Oh.
Have we lost Rachel somewhere?
I'm here.
Okay.
I'm on mute. So that was a quick run through of the sort of work we've been doing. And obviously we recognise that design's been used all the way through the pandemic. And whilst we can present future scenarios for design, it's interesting, actually, in most countries, around the world, pandemic has always been on their top of their risk register, but I don't think it's been on the top of the risk register for designers. And it's interesting how design has been designed by non-designers and by professional designers. And at the beginning of the pandemic, I think what we saw was that you had the community coming into the space, and then the professional designers sort of started to take over. I think what is clear is there is a need for innovative and collaborative and cross-disciplinary approaches for a future resilience to pandemics and other global challenges. We need to place, if people have heard me speak before, we need to place design centrally in this. Often it's an afterthought, and we know that design has a strong position and is able to contribute to move forward and build resilience. And we hope that this sort of database from us and other places illustrates the role of design, and there is a recognition globally that we need to think on new ways and all scales, from sort of hyper local to hyper global to the north and the south to all communities. So we need to rethink and redesign communities and what we do and how we move forward and how we become more resilient, both to pandemics and to climate change. So we'd like to have a discussion about this further. And if anybody is